Hello everyone, we are with HPS, the Human Patient Simulator. HPS is a high fidelity mannequin that is realistic and lifelike, like you can see. The room that houses the HPS could be a mock OR setting, a mock ICU setting or a mock ER setting with their respective equipment. Let's explore the features of HPS. HPS can blink his eyes can be closed when he is unconscious, and interestingly we can also check the pupillary reaction of HPS. So with respect to his airway, he breathes in oxygen and exhales carbon dioxide as we all do, and you can go for a tongue swelling or obstruct the pharynx and the larynx and create a difficult airway situation. With respect to the respiratory system, we can auscultate the different areas of the lungs and auscultate for rhonchi, for wheezing, for crackles and crepitations as well. When it comes to cardiovascular system, we can palpate all the pulses, most pulses such as the carotid pulse, the brachial pulse, the radial pulse, the popliteal pulse and the dorsalis pedis as well. With respect to cardiopulmonary resuscitation, a participant can perform cardiopulmonary resuscitation on the HPS and also deliver real-time shock or cardioversion on both of these metallic plugs, as in 360-degree joules or the respective joules for different arrhythmias. So let's move on to the monitor. You can see different variables on the monitor. On the monitor you can see the heart rate. We can change the heart rate, we can produce dysrhythmias, we can lower the blood pressure or increase the blood pressure, and we can decrease the saturation or increase the saturation based on our scenario. We can also perform catheterization and monitor the urine output on HPS. A unique feature of HPS is the drug recognition system, where most drugs, emergency drugs, are barcoded, and these barcoded drugs, when delivered into the drug recognition system, reflects the physiological changes, and those changes can be seen on the monitor as well. It is also interesting to note that we can deliver anesthetic gases such as isoflurane and sevoflurane into HPS, and HPS has sensors that can detect oxygen, carbon dioxide and these anesthetic gases, and we have performed various anesthesia crisis situations in the OR for anesthesia residents as well. So this is the rack of the HPS, where oxygen, medical air, carbon dioxide and anesthetic gases are connected, which delivers the respective gases onto the HPS. This is our console room, where the software that is connected to the HPS with various variables and clinical scenarios are there, and we have as you can see, we need at least 2 or 3 facilitators. One of them is ticking the checklist if the students have done the right, or noting down those points that haven't been done right, and also there's one facilitator that is using the software to produce different physiological variables in the patient. The various domains such as knowledge, skill and attitude can be assessed by using HPS. With regards to nursing students, they come here to learn about opioid poisoning, about the different physiology such as normal heart sounds and abnormal heart sounds, normal respiratory system and abnormal respiratory respiratory sounds as well. Certain disease states such as pneumonia, pneumothorax and ARDS can be replicated on this as well. Certain cardiac conditions with abnormal auscultatory findings of the heart sounds, murmurs, and like I have already shown you, the different dysrhythmias which can be present in various disease states can be replicated on the HPS. With regards to our MBBS students, we have done various clinical scenarios from burns to acute abdomen series, and also wound certification for our forensic students. Also horizontal integration classes for the anesthesia residents and surgery assistants, where we would mimic laparoscopic cholecystectomy going on for once the pneumo is installed in the patient, going in for systolic arrest, and how they perform as a team, their knowledge, skill and attitude, all of this along with their human factors and team dynamics will be assessed by the facilitators.